Yes, sir.
Hi, welcome to the show.
Okay.
Did you get some snow, by the way?
No, sure didn't.
Okay, what's your question for Dr. Speight?
Okay, I have chemical sensitivity. When I get around strong odors, I black out. And I also have IBS and depression. Are these all related?
And IBS, of course, irritable bowel syndrome, right? All right.
Yes.
Good question. Thank you.
Yes, they very well could be connected. Irritable bowel is, in all likelihood, has a higher incidence of increased intestinal permeability, and that in turn leads to this chain of events that we've just covered, showing that, yes, depression can occur.
Okay, so what would be your advice for such a patient who just phoned in those symptoms?
The first thing I would want to do is take a good history. Why does she have multiple chemical sensitivity? That's a diagnosis that's actually debated in some medical circles anyway, but we would sit down and go through her history. Has there been exposure? Does she live near a chemical plant? Did she get doused with dry cleaning fluid? Was there something else in her history that could have triggered an immune response and that now causes her to be hyperactive to chemicals? I would look at, in the case of her depression, a full panel of B vitamins, probably do a urinary neurotransmitter test, and try to piece this together, and of course evaluate her for increased intestinal permeability.
And once someone is diagnosed, are they looking at lifetime treatment?
You can, in a matter of 3 to 6 months, you can be significantly further down the road towards health by following certain steps that allow you to basically clean up your intestinal tract. Sounds hard to do, but it's really not. I mean, you measure the balance of bacteria. We can do stool analyses as well, and based on that, give certain probiotics that are needed to repopulate the gut.
You know, and this is right off the cuff, but there's so many infomercials out there right now of cleansing the bowel. Is this what we're talking about here, or is this totally
not
something
necessarily. I had a woman some years ago who went off and did what they call a colon cleanse on her own, and ended up triggering an autoimmune illness as a result of that, I believe. I mean, it was very directly connected, and so I think people need to be prudent. It's not that colon cleanses are inappropriate necessarily, but make sure you know where you're getting your colon cleanse products from. She was using a series of herbs that I don't think they may have been contaminated or laced with something intentionally or unintentionally, but it triggered a problem with her. So no, I'm not necessarily talking about colon.
Gotcha.
Cleanses.
All right. Let's go to the next set of slides. We have just a few more to go through, and the time is quickly escaping here. Go ahead.
Well, these two slides are from two major journals, just, again, depicting what happens with the immune system. When immune cells are exposed to these cytokines, they travel back up the spinal cord and
all right.
into the brain.
We're going to try to get back to the slides here. I was trying to give a little motion to our directors back in the control room. Maybe the computer just blew up. I don't know. And did we have another caller on the line? No. I'm sorry, Sue from Rock Hill? Go ahead. You're from Rock Hill. I didn't get your name. Tracy, you're on the air.
Hi, thank you very much. My question is, do you see much of a difference between when you treat a patient strictly biologically versus when a therapeutic intervention is introduced?
Ooh. Such as what sort of therapeutic intervention?
Like, for example, with depression, you know, anything from cognitive behavioral therapy to reality therapy.
Well, actually, the studies show that cognitive behavioral therapy probably works about as well as medications do. And yes, has not been the focus of what I was talking about tonight, but yes, you're right. Those are very important. Looking at the other environmental influences, and I don't just mean chemicals, but emotional environmental influences, is important, and they can contribute greatly to resolution of depressive symptoms.
Okay.
So.
We thank you for the call, Tracy. I think we have a few more slides to go through, so let's see if we can bring those back up. All right, we are having a little computer problem there. Is it Claudia from Albemarle? Corey, hi, you're on the air.
Hi.
Hi, what's your question for Dr. Speight?
I have taken every antidepressant that there is nearly, and I've had fatigue from all of them.
I'm sorry, you've had a what?
I've had fatigue.
Fatigue. You're tired.
Yes. I sleep at least 12 hours a night and nap throughout the day, and it used to be even worse than that at times.
And you've been on a lot of depressive-type medications, I've been told?
Yes. I've been on nearly everything.
All right, and the question would be what, Corey?
Excuse me?
I'm sorry, what is your question?
I've tried different bipolar medicines, but I've had side effects to every single one of those medicines. And I'm just looking for something that I could take to get rid of the depression without the side effects.
Okay, thank you. Dr. Speight?
Probably, without knowing your full history, it's hard for me to completely...
Yeah, and that's not the
and
intention of what we're trying to do here on HealthWise, is to give a diagnosis over the air. But if you could speak generically...
Well, yeah, other considerations would be, you know, depending on your age, you may want to have your hormones checked. It could be a thyroid issue. You may have problems with estrogen. If those things have already been addressed, if you never got the first benefit from a medication, then there's perhaps some other issue that needs to be looked at in more detail. Often I find that if the B6 or B12 levels are low, that can influence this as your energy level as well. So if you've not had an evaluation of intestinal permeability, you should certainly do that also.
All right. We thank you so much for that question. Tell us a little bit more about how hormones affect depression.
Well, there are some cases of depression that even if the thyroid is normal, adding free T3 or triiodothyronine, the active thyroid, actually helps those people in severe refractory depression. Other women, particularly women who are in the postpartum area of their life in the first several weeks after delivery, they can experience problems with severe depression that's related to estrogen deficiency, and by supplying them with estrogen, you can improve 60 to 70% of those women. And then there are men who are also struggling with mild to moderate depression in their 40s and 50s, and I've seen some of them who just feel a bit overwhelmed by the world, and they're angry because they've never felt this way before. We check their testosterone levels; they're actually low. When you replenish their testosterone, their depression seems to get better. In fact, there was a study just recently in the Journal of Clinical Psychiatry confirming that very thing.
Wow, and I think we have a caller to maybe that effect. So let's go over to Gastonia. We have Bill with us. Hi, Bill.